The topic of the workshop tonight, this is all about heart disease, and the damage here that's really being done out there in our community with the people that are around us, and unfortunately with too many of my patients who, unfortunately we don't have an effective means to get to everybody, and get them to understand this stuff. Is we're walking in blind faith by what our doctors are telling us, by what cardiologists and and all of our internal medicine doctors are telling us about these medications. But honestly, I don't know what information they're reading other than getting the information from the drug reps that are selling them the drugs, because it only takes a little bit of research, common knowledge, physiology understanding, just to really get to the bottom end of this and find out what's really truthfully going on. So I'm going to show you everything tonight, including the research, including, going through actually how the system works. So once you have all that together, you'll know exactly what to do, and you can start to tell the people around you, of what these medications are really doing to them. Because otherwise, we're going to continue to see, our friends and family go right down the same lines that, with everybody else with heart disease, which is seeing that number escalate every single year. The number is getting bigger and bigger and bigger, and it's happening faster and faster because we're not getting down to the bottom line of what of the truth. It's basically just this big old paradigm built around false information and faulty research, that instead of just coming out and just flat out admitting that we were wrong, all along, they just keep on building on buttresses to just try and keep the whole thing supported and keep the whole theory from not falling apart. But it's a mess. It's falling apart. It has fallen apart. And it's time to just fess up and understand, and just come to the conclusion that we were wrong and fix the problem. But, how that's going to happen, I don't know. So that's what this workshop is about, is just to make sure that so it doesn't happen to you and your families. So here's just some basic fundamental statistics. The leading cause of death for both men and women is heart disease at this point. Now they're saying that the number is being toppled over by cancer. But the bottom line is both of them are just going, back and forth and back and forth. Should that be happening, or should the number be going less? I mean, with all of our technology and breakthroughs and understanding and and all of our knowledge and wisdom, don't you think we should be seeing the number go in the opposite direction? But instead, for the first time, we're starting to see the life expectancy of women actually change this last year. Now we're seeing the life expectancy of women drop. That's only happened a couple times in history. One of them was actually, I believe, during the Holocaust, which for obvious reasons that would happen. And the other one was like during the Great Depression or something like that. So for the first time, we're actually seeing that happen again. 29% of U.S. deaths are from heart disease. 29%. So nearly 30% of people are dying because they're not getting the right information on how do I keep my heart healthy, and secondly, following through on it, to actually making sure that they're following the right information. The death rates are 30% higher among blacks than whites. So if it's not bad enough, we're seeing that there's even more damage being done if you happen to be African American, and I believe Hispanics are in the same category too, being higher numbers than whites. 71% of all heart disease deaths are coronary. Okay, now this is huge, and I'm going to be talking about that as we move on. But why is it that 71% of heart disease deaths is because of coronary artery disease? Why is it not any other arteries? Doesn't that make anybody wonder? If it's a systemic problem, why is it the same thing over and over again? So costs the U.S. healthcare system, and just the U.S. in general, $258 billion. So, you look at these, we're all about stimulus packages right now. Well, I got a stimulus package for you. Let's get this right. If we just got heart disease right, then that would be an extra $258 billion stimulus package every year into the economy. How about those numbers? This includes health services, medications, and lost productivity. Worldwide, coronary heart disease kills more than 7 million people every single year. So every year, 7 million people are dead because again, we're not being told and following the truth. You think about how big a deal the Holocaust was again, and I mean, this just dwarfs it in terms of what's really happening out there. just out of misinformation. This graph over here on the side, this is from the CDC's website. You can see where is most of the heart disease concentrated on that map? Yeah, right around us. You know, it's Mississippi and Alabama.
Mississippi.
Yeah, Mississippi, Alabama, and Louisiana is right at the heart of this thing. You know, so you would think, you know, for a heart disease workshop, you know, we should be filling stadiums, you know, with people. We shouldn't even be doing this in our office. We should be doing it down at the convention center. But don't you see that's the problem?
Isn't that the top 3 states of obesity?
Yeah, top 3 states of obesity. Right. It's down here. Well, now, hang on. In Super Size Me, they said that Texas was actually the fattest state in America. Yeah, Texas. So it's not just the largest state. They said it's got the largest people. But yeah, we're just, I mean, in all categories, the South does terribly. So, but you know, as that point I was making, you know, you would, part of the problem is that people aren't that concerned about it. You know, that people aren't putting forth the energy and effort to figure out what to do so that they can actually turn the situation around. And that's part of the problem. So here's the top selling drugs, you know, because of course that's a method of choice, you know, pick your poison. Lipitor is the #1 selling drug in the world, and it has been for a number of years now. The cholesterol drug grosses $8.4 billion per year. $1 billion. Okay, Zocor, #2 drug for cholesterol. So the #1 and #2 drugs are both for cholesterol. That drug grosses $4.4 billion. Nexium, which is acid reflux, and Prevacid, also for acid reflux. Those take 3 and 4. What do those come down to? Somewhat dietary, you know, dietary/functional issues. You know, so it goes back to looking like it's leading down the same problem. Okay, both of those, 4.4 and 3.8 billion. Advair is for asthma, which is a immune system dysfunction, $3.6 billion. Plavix, heart disease, $3.5 billion, and Zoloft for depression, grossing $3.1 billion. So, you know, you can see out of this, just out of the top 7 drugs, 3 of them are for heart disease. Shouldn't be any surprise, right? You know, should be no surprise. But you might be surprised once you start figuring out what the truth is behind these drugs and the way that they actually work. Cholesterol-lowering drugs can increase the risk of cancer. Okay, studies show they mimic the growth factor VEGF, which is vascular endothelial growth factor. Okay, that's a cancer fertilizer essentially, and it's responsible for increasing proliferation of cancer within the body. So it's kind of like, you know, you've got cancer in the body and you're just dumping fertilizer on top of it. You're just making it grow faster and faster and faster every time that you take cholesterol medications by action because of these growth factors. Growth factors are very powerful within the body. You know, we actually use some growth factors here in the office for HGH and IGF-1, which are which are good growth factors, you know, but they're powerful in what they do. They change everything. The British Medical Journal has reported that only 30% of statin drug trials have reported the number of participants with 1 or more negative side effects caused by the drug. Okay, so they're not reporting the side effects. If they reported the side effects, what do you think would happen? Yeah, wouldn't be approved. So they wouldn't make $8.4 billion, would they? So where does the drug funding come in for these studies? Where's the funding coming from? From the drug companies. Who funds the FDA? The drug companies. Do you see the problem? You know, so the drug companies fund the research, and then essentially they're responsible for paying like 1/3 or 2/3, I don't remember exactly what the number is, of the funding for the FDA. So they're basically, you know, what is the FDA going to do? Bite the hand that feeds them? You know, it's set up like a drug company, you know, so of course we're going to have these conflicts of interest. According to USA Today, statins have killed and injured more people than the government has acknowledged. Is anybody surprised? Yeah, we shouldn't be surprised. You know, when that's the way that the system works, that's what you're going to get. You know, so it's got to change, you know, just in the fundamentals of the way that it all works.
And statins is the type of drug that
Right, exactly. Yeah. statins. Okay, so Crestor, let's just take a look at one of these. Taking the statin drug Crestor, also known as Rosuvastatin, slashed the risk of heart attack by more than half, according to the Jupiter reports. That's what you heard on the media. Okay, that's what was propagated in all the magazines and news stations and everything else. Well, the truth, according to Dr. Mark Hlatsky of Stanford University, told the New England Journal of Medicine that absolute differences in risk are more clinically important than relative reductions in risk, which is what this number was based on. So, using in the deception, the absolute difference in the risk, 0.9%. So the drug improved effectiveness or improved longevity or whatever it is that they were looking at, a risk of heart attack, it altered your risk of heart attack by a whopping 0.9%. So, but if you use the drug over the patient's lifetime as recommended, they found that it would cost them $500,000 to use the drug as prescribed.
This woman also has a blood pressure medicine combined in it, doesn't it? It treats high cholesterol.
If I'm remembering correctly, it's Vytorin that actually has two of them. If I'm correct in that, but don't quote me on it. So do you think anybody would be jumping out there to get on Crestor if they knew it was going to improve their chances of health by 0.9%? It's like if I said to you, you know what, I want you to sign up for this care plan, but we have a 0.9% clinical proven efficiency that if you do all of your therapies and you make all your adjustments, that you might get you got a 0.9% chance of improving your curve. Would you? Yeah, no, nobody would be jumping all over that. We got a 0.9% chance of improving your immune health. You could do more by eating an apple. You could do more by, cutting soda out of your diet. But this is the kind of stuff that happens all the time because they twist the numbers and yank them and pull them any way that they can so that they can sell the drugs. And do they sell them? Oh yeah. They're making billions off of them. So if cholesterol was the problem, okay, if it was really the root problem, then why is it that 90% of the time heart disease is caused by narrowing of the coronary arteries of the heart alone, while the rest of the arteries, veins, and capillaries all throughout the body remain completely healthy, even though they're rich in cholesterol and fat? How can we explain that? Yeah, obviously something's wrong there. Physiologically it just makes sense. If you got cholesterol and fat everywhere and those things are really bad for you, that you would see heart disease everywhere. You would see it as a systemic problem, but it's always the coronary arteries in 90% of the cases. This entire theory is based on a lie. That's the bottom line. The drug companies know this. They don't want you to know about it, because the entire thing would fall apart overnight. All their patents and everything would be completely and totally worthless if the general population just understand this. I mean, it is that simple. It is that simple. The cholesterol is everywhere. If that's the problem, you wouldn't see that happen.
World Health Organization set up a study called Monitoring Trends in Cardiovascular Disease. I think it's just amazing that you can see this data and still sustain the cholesterol hypothesis. What I did was just plotted the cholesterol levels and the rates of heart disease in most of the European countries. And I added into this graph the data from Australian Aboriginals. The reason for looking at Australian Aboriginals is that they have the highest rate of heart disease in the world currently. And so you'd probably expect they had a high cholesterol level. But when you look at it, what you find is the Australian Aboriginals have the lowest cholesterol level of any population studied. And they have a heart disease rate that is about 30 times that in France and about 15 times that in the United Kingdom. And if you look to the right of this graph, and you can see that the Swiss have the highest average cholesterol levels of any population or country in the world, and their heart disease rate is about a third of that in the United Kingdom. And wherever you look, you basically see there's no correlation between cholesterol levels and heart disease. None at all.
So what does that tell you? That tells you that there's that cholesterol, again, that's just one more piece. That cholesterol is not the problem. So here's just a couple more things. Cholesterol lowering drugs decrease coenzyme Q10 levels within the heart. This nutrient serves as an energy producing molecule and is crucial to proper cardiovascular function. You have to have it for heart function, yet the drugs deplete coenzyme Q10. Now what do the doctors do? Now they're going out at the bidding of the drug companies, and they're telling you, well, take the cholesterol medication and you have to have that. You got to keep taking that medication, but here, take some coenzyme Q10 along with it. Okay, so just because you're putting the pill in your mouth, the coenzyme Q10 in your mouth, that's supposed to just fix the problem of the depletion that the drug itself is causing, right? Okay, so without it, the heart fails. Okay, congestive heart failure is actually the outcome. If you don't have coenzyme Q10, you go into heart failure. So what would you expect to see with that? You would expect to see rising death rates from heart disease. What have we seen for the last 10 to 15 years since cholesterol medications and blood pressure medications have been used? We've seen the rates continue to rise year upon year upon year. 30%. We're not seeing the problem get better. We're seeing it get worse. Cholesterol works to ensure the integrity of the myelin sheath of the nerve system. Okay, the nerve system literally breaks down in the absence of it. Okay, so let's look at this issue from a chiropractic standpoint. We're adjusting you and adjusting you and adjusting you, but basically the cholesterol drugs are creating destruction of the myelin sheath of the nerves, which mimics multiple sclerosis or breakdown of the nerve system. How good are your adjustments gonna work for you? Not very good. So,
Are you saying that it's working against, because that's what medication is, it's working against the adjustments?
Bingo, that's exactly what I'm saying. That the cholesterol medications destroy the myelin sheath around the nerves. The myelin sheath is literally it's a sheath around the nerve fibrils that actually helps to transmit the signals faster than the speed of light. Okay? If you break down the myelin sheath, you get aberrant firing of the nerves. They don't fire properly. They don't transfer signals properly. So essentially, your organs, and anything at the other end of that nerve doesn't work properly. So, your MS is the same thing. MS is destruction of the myelin sheath. That's what that disease does. Okay, it's more of an autoimmune manifestation of that, but it's the same thing. Loss of the cervical curve, same thing. It produces a destruction of the myelin sheath, but just by a different mechanism. This one is a chemical breakdown of the nerve system. Okay, so yeah, you're working against chiropractic and what we're trying to do here if you're taking cholesterol medications at the same time. It's basically negating a lot of the effects. So more than half of the people who suffer from heart attacks, this is the biggest one of all, more than half of the people who suffer from heart attacks have low cholesterol. They have low cholesterol. Okay? What does your doctor tell you if they, when you say, when they find out that you have high cholesterol? Let's say I'm your doctor and I say, or rather you're my doctor and you're telling me that I've got high cholesterol, and I say, well, yeah, but I don't want to take the medications. What do you expect the answer typically is?
Do you want to die?
Do you want to die? Do you want to die? Or you're going to die. But wait a second here. Half of the people, more than half of the people, more than 50% of the people who have heart attacks have low cholesterol. And high cholesterol, 300 to 350 milligrams per deciliter. Is anybody panicking? When they hear 300 to 350, oh my goodness, is natural and a healthy part of aging. The higher total blood cholesterol, the longer people live.
Say that again.
The higher the total blood cholesterol, the longer you're going to live by the research.
So now you tell me I'm doing good.
It's insane.
It's 326.
Yeah. This is what is being, it's the opposite of this that's actually being sold to people.
Yeah, I think they say under 200.
Yeah. Yeah. And oh, it gets better. It gets better. Whoa, trust me, I'm not done yet.
So now, my cholesterol the doctor says fine now. But if it was high, then I would be even fine.
You'd be in better shape. Yeah.
It's from McDonald's.
Yeah.
Just kidding.
Well, and yeah. Here's the thing. The reason why, okay, you've got to put this in perspective. Here's the difference, okay? And to make this absolutely crystal clear, that doesn't mean we should go out and try to make our cholesterol higher by going to McDonald's. What that means is that if you are, if you take two people who eat the same exact diet, let's say two people are on the McDonald's diet, okay? You've got Joe and you've got Jim, okay? Well, Joe over here, his cholesterol naturally is supposed to be 350 given his diet, right? Okay, Jim, his cholesterol is supposed to be 350 given his diet, okay? But Joe over here, I think I still got the names right, Joe over here takes cholesterol medications, okay? While Jim doesn't, okay? Well, what the research says is that Joe is going to die faster. He's actually going to die earlier because the cholesterol protects the body from the poor diet that Joe and Jim are eating. Right. So, here's more. The European Heart Journal published a 3-year study of 11,500 patients. Small study, 11,500 patients, finding those with low cholesterol to have a risk of all-cause death 2.27 times higher than those with high cholesterol. So from nearly 12,000 patients, again, one more study proving you're more likely to die with low cholesterol than with high cholesterol.
Is that the ratio?
There's we'll talk about the ratio too. Yeah, we're going to cover it all. The Journal of Cardiac Failure published an analysis of 1,134 patients with heart disease and found low cholesterol to be associated with the worst outcomes in heart failure patients and impaired survival, while high cholesterol improved survival rates. Okay, so one study after another because cholesterol is a protective unit, which we're going to talk about. The American Geriatric Society reported in 2003 in patients over the age of 65, even cholesterol levels up to 417 were associated with lower mortality compared to levels under 189. So, it's just study after study after study pointing to the same thing again and again and again. Do you think the drug companies want you to know this? No. And, unfortunately, it's gotten to the point where I don't think the doctors want you to know this either because immediately they find out that they've been lying to their patients. But, really, it's not lied. The problem is the doctors have been lied to. It's not their fault. It's not, your cardiologist you might have given this DVD to, it's not his fault or her fault. It's because they've been lied to. They haven't gotten the research. They haven't been told the right stuff. They've been sold by the drug companies. It's all the same mess, just done for profit. So what about blood pressure drugs? Drugs such as Toprol XL, Lopressor, Tenormin, and Coreg serve as fat fertilizer to the human body. Okay, so what do we see a direct correlation with? Obesity and heart disease, right? And diabetes and cancer. Yet the drugs for those problems actually fertilize you for fat, which makes you even larger, which increases the probabilities even more. Patients who follow doctor's orders and swallow beta blockers and diuretics are at a 28 to 50% greater risk of suffering from type 2 diabetes. 28 to 50% for taking blood pressure medications. It doesn't address the cause, and that's the bottom line. None of these things address the cause. They're looking at something completely different. So watch this video here.
If you could pack all of human history into 1 year, we've only been farming and eating grain since about yesterday, which is when we became shorter and fatter. We only started consuming processed vegetable oils about 10 minutes ago, which is when heart disease became our #1 killer. So after examining all this human history, the experts came to the obvious conclusion. We need to eat a lot more of these. And so they convinced us that human health depends on foods we didn't eat for more than 99% of our entire existence. How did this happen? In the 1950s, a biochemist named Ansel Keys published a study that compared heart disease and fat consumption in a half-dozen countries. The more fat, the more heart disease. The trend line was unmistakable. Just one little problem. Keys left out countries where people eat a lot of fat but have very little heart disease, like Holland and Norway. He also left out countries where people don't eat much fat but do have a lot of heart disease, like Chile. In fact, Keys had reliable data from 22 countries, and the results were all over the place. But you can't make a big splash in the scientific community with a trend line that looks like this. So Keys did what any dedicated researcher would do. He threw out the data that didn't fit and published his results. His punishment for this bit of scientific chicanery was to get his picture on the cover of Time magazine. Keys became known as the father of the lipid hypothesis, which says that eating saturated fat raises the cholesterol in your blood, and high cholesterol in your blood clogs your arteries and causes heart disease.
The hypothesis that when you eat high fat, that produces high cholesterol, and the cholesterol produces heart disease, is wrong in every one of those links.
This whole idea that dietary fat causes cholesterol problems is sort of a myth. The whole idea that cholesterol problems lead to heart disease is a myth.
The theory is completely and totally wrong. It was a theory that was made out of whole cloth and then pushed.
The term artery clogging saturated fat, it's as though it's all one word.
It's become part of the zeitgeist. Everybody knows saturated fat is bad for you, but when you get back and you start looking at the medical literature and you root back through to find out where this whole idea came from.
The bottom line is, it's not true. And all of this comes down to, I think Mark Twain said it best. If you find yourself on the side of the majority, it's time to stop and rethink. It's time to reassess the information, because what happens is you've got a pile of research and information and everything out here, and then you've got what everybody else is saying. Well, what's easier to do? Just kind of follow along with what everybody is saying, or go and read all this pile of research and try to figure it out yourself? It's always easier to just go over this way. Well, the problem is, who's giving out the information that everybody is following? The drug companies. They're the only ones with the money to do it. And it just keeps getting worse and worse and worse all the time. They just keep shoveling you more junk. So what about if you're diabetic? Okay, Avandia users, which is just one of the drugs of choice, has a whopping 30 to 40% increased risk of heart attack and other heart-related adverse events, including heart failure, compared to patients treated with placebo. So now you're diabetic and you take a drug for diabetes, and it loops back to another problem, which is all part of the same charade. Injecting insulin or taking drugs does nothing to reduce the level of sugar going into the body. Okay, it does nothing. What do I mean by that? It doesn't stop the Twinkies from going into your mouth. It doesn't stop the cakes and cookies and everything else from going into your mouth. So it doesn't do anything to address really the problem or even how your body burns the fats. It doesn't change any of that. Okay, doing the above actually causes your body to stop producing insulin naturally. Anytime that you put something in artificially, the body stops doing it naturally. You can see it with thyroid medications too. You start putting in thyroid hormones, the thyroid does not have to work anymore. If you start putting in estrogen supplementation, the body doesn't have to make estrogen anymore. It's getting it from the outside. Your body sees everything from an energy standpoint, to where it's going to look for the most efficient means. Okay, so which one's more efficient? To try and manufacture everything on your own? Let's say you're a shoe factory. You can either manufacture the shoes or you can steal it from the guy in the building next to you. Which one's easier? So you're always going to go that route. Your body is going to go that route because it's always built on efficiency. Okay? So this also, of course, that all just leads to drug dependence. And what's the name of the game? The name of the game is drug dependence. They just want everybody on how many medications? 2 medications for life. That's the goal and the objective out there by the drug companies, 2 medications for life. So, but you will die, right? Your MD screaming at you, but you will die. If you don't take these medications, you're going to die if you don't take the blood pressure medication. You're going to die of a heart attack. You're going to die of a stroke. You're going to have an aneurysm. Your cholesterol is going to kill you. You can't just not do anything, and you can see that. You can see the face getting red and the veins coming out of the neck, and maybe even the tears flowing down the eyes of, the compassion of, well, I just can't understand why you're not listening, because you're going to die. These drugs have been on the market for 21 years. 21 years. Yet they are the best-selling drug class in the history of the world. Yet there is still not a single study that documents a health benefit to women of any age. Doesn't matter how old you are. No age makes any difference, or men over the age of 65. The only positive documentation in the study, in the literature, is for men under the age of 65. Yet, how many women are taking these drugs every single day? Going on to the next one, by the way, that was John Abramson. He's a professor at Harvard Medical School. He's one of the physicians at Harvard Medical School. So this isn't a chiropractor leading out this information. Prosper, this was a study sponsored by Bristol Myers Squibb. It suggests no longevity benefit from taking a statin. Okay, this was a drug company funded study that came out, that basically they were forced to put this out. I mean, the information had to come out, and no longevity benefit. CNN Money, all of this stuff, what does this lead to? CNN Money says that the retirement health tab can run between $64,000 and $122,000 for a 65-year-old man whose former employer pays his insurance premiums. Okay, so that's above and beyond insurance, and between $86,000 and $140,000 for a woman of the same age. For retirees who don't have access to an employer-offered plan, the costs, mostly for prescription drugs, run even higher. Okay, so I don't know too many people that can afford that kind of a tab after retirement. So what happens? Well, Medicare happens, right? That's what it's for. Medicare is there to help us pay for our medical expenses that we can't afford on our own. Well, when everybody's sick, how do we pay for Medicare? We don't. So guess what's happening? It's getting too expensive. We can't pay the bill for Medicare. So eventually the whole thing is going to collapse again. What are we going to do? Is the stimulus package going to fix that? Who are the working people? If everybody's sick, who's working and making the production to actually make it happen, to be able to pay for everybody else's healthcare expenses? I hope we have a lot of chiropractic patients, that are fully functional, because we're going to have a large tab to pay. So here's the true cause. The true cause of all this stuff, and the reason why they're completely lost, is because it's all about inflammation. It has nothing to do with cholesterol. It has nothing to do with blood pressure. Those things are secondary to the problem. They're just side effects of the main problem. So you look at this chart here, and this is a normal artery here. You can see that you have normal blood flow. Here's the artery wall. Arteries by nature are muscular walls, okay? And you've got the cross section. You've got plenty of room for the blood to move through. Think of it like a pipe, okay? Like the toilet pipe, over in the bathroom, okay? So as long as that pipe is full and open, you can have Joe or Jim go in and use a restroom, right? And it's not going to overflow all over the place, okay? But if you go into the section picture here where you've got the narrowed arteries because of the inflammation, the muscular wall of the artery actually inflames. Okay, so naturally as that inflames, it cuts down on the space that blood can flow through there, right? Okay, so now, equate that to Joe or Jim going into an old hotel, where the pipes haven't been changed in 60, 70, 80 years. Okay, so they're all rusted and corroded, and now they've only got that much space in there. What happens when Joe or Jim uses that restroom? It backs up, right? It doesn't go down. So now you got to call in Roto-Rooter to fix the problem. But, here's the problem, and here's where it makes a difference. We're not just talking about pipes on a toilet. We're talking about the human body. Okay, and this is what's important here. You've got the lungs over here, which are feeding oxygen into the bloodstream, right? Okay, and you've got the brain or the liver or the kidneys or any other cell, tissue, and organ in the body over at this end. Okay, well, what do you know about the brain and all the organs? What do they require in order to stay healthy? Oxygen. Okay, so what do you know about blood? Does it, can it carry a particular amount of oxygen, or does it have an unlimited carrying capacity? It's limited, right? You have to have anemia. Anemia causes a decrease in oxygenation in the body because it can't carry oxygen. Okay, so you've got the lungs feeding oxygen into the blood, but as the blood tries to squeeze through here, it can't get through because of the inflammation, right? Okay, so what happens to the brain or the kidneys or the artery or the liver over at this other end? They don't get oxygen. Okay, so what do you think those? Let's take the liver for example. What does the liver now do? The liver screams to who? The brain, I'm not getting the oxygen that I require. Okay? So what does the brain do in response to that? Can it fix the inflammation? Apparently not. Because there's something in there causing the inflammation. So what's the next option? We got to figure out how to push more blood through. Well, how do you do that? Pressure. You increase the pressure. So the body increases the blood pressure to push more blood through in order to feed that liver the oxygen that it requires. So now you go to your medical doctor and they put a cuff around your arm and they read your blood pressure. And they say, oh my goodness, your blood pressure is 160/85. You have to get on blood pressure right away. Your heart's going to blow up, right? Your heart's going to explode inside of your chest. So they put you on blood pressure medication. Now it lowers your blood pressure. Against what the body's trying to do, it lowers the blood pressure. What happens to the liver? No oxygen. So it dies. So the other organs of your body die because we're killing the body's own ability to fix the problem in an intelligent manner. In an intelligent manner. Do we really, as B.J. Palmer always said, the founder, the developer of chiropractic, does our finite mind know more than the innate wisdom that put the entire body and pieced it together and keeps it functioning on every single second, every cell in your entire body? Does your finite mind have the ability to do more so? Not a chance. But that's what happens when we try and mess with the system. It always backfires. Because our finite minds cannot understand the way that this stuff works. So your liver suffers as a result of that. You don't get the oxygen through. Now you decide, well, I don't know, maybe it's not a good idea that I should be taking these blood pressure medications, or maybe it's not even that. It's you go on vacation to Aruba for 2 weeks and you forget your blood pressure medications and you can't get a prescription in Aruba. So for 2 weeks you don't take your blood pressure. What immediately happens as soon as you get off of those drugs? The blood pressure shoots back up, right? It shoots back up. Well, why in the world would it do that?
Because you don't hear those.
Because the brain knows what to do. Because the second that the brain sees that you got out of the way, that you remove that interference, the doctor can either create or remove interference. The second you remove that interference, problem's gone, it shoots the blood pressure back up to where it's supposed to be. Does all that make sense? Okay, so cholesterol now, well, let me back up here. Okay, over time, blood sugar reacts with amino acids floating nearby. This is how inflammation happens. This is just one of the means. So sugar floating in the bloodstream binds up with amino acids, and the product of this reaction is advanced glycated end product, or called AGEs. Okay, and that product cuts and stabs the arterial walls. Okay, so it's basically walking around like a chisel on drywall, just gouging up this drywall left and right. Well, if I'm walking around gouging the drywall, and you're the drywall mechanic, what do? You go back with spackle, right? And you go and you start smearing up those holes. Guess what cholesterol is? It's the body's spackle. So guess what happens when you get rid of the cholesterol with a cholesterol drug? You're eliminating the spackle, which lets that damage just continue to happen again and again and again. So you damage the arterial walls. Okay, so diabetics have 4 times the risk of heart attack relative to non-diabetics. Why is that? Because they got a lot more sugar in their system. Do you see how all this, it's all just the same problem. It's the same systemic issues that lead to one disease after the other after the other. It's all one big pool, one big problem. Okay, so what should you do? Medical literature shows that as we age, blood pressure rises slightly, and this increase does not put us at any risk of early death. Okay, it's a natural process of life. Why? Because your body is doing more damage. You know, it's not able to keep up with the damage as fast as you get older. So you need more oxygen and more nutrients. So your body is naturally going to push through, you know, not only that, but your veins, the muscular walls are going to start to deteriorate a little bit harder, and, you know, basically your body gets less fluid, you know, so it's got to increase the pressure just to keep things moving through the system. It's just a natural part of aging. It is completely natural for the first number, your systolic blood pressure, to be 100 plus your age. 100 plus your age. So, so a 65-year-old, they're telling you that your blood pressure should be 120 over 80. But do you see that that's not true? If it goes up, it's okay in most cases. So bottom line is, throw away the drugs. You know, now I'm not a medical doctor. I can't tell you specifically as an individual, throw away your drugs, Susan, or throw away your drugs, Sam. That's not within my scope of practice. You know, but the bottom line is, the drugs are killing you. I have to do my moral and ethical obligation to tell people the truth. You know, so while I can't tell you individually, I'm going to tell people generically, you know, that you better figure out what these drugs are doing to you, and you better be telling everybody that you know that's taking these drugs of what they're really doing to you.
So you have to fix the inflammation.
You have to fix the inflammation.
Before
yeah.
You can
but the
get rid of the
cholesterol
medication,
fixes
is
the
what you're saying.
No.
Cholesterol fixes the inflammation.
Cholesterol fixes, well, cholesterol spackles the damage to the arterial walls. Now, you need to get rid of the inflammation, yes, but you know, even if your blood vessels are still inflamed, if your arteries are still inflamed, but you cut off the blood pressure medication, what are you really doing? You're increasing oxygen supply to the muscles and the tissues and the organs. So, you know, do you wait to give your organs oxygen until you clean up your inflammation in there? You know,
What if a blood pressure is 220 over 160?
My question would just be, how many people's hearts have exploded at that level? You know, that would be my relevant question, right? You know, there's obviously a reason, a fundamental reason why that person's blood pressure has to be that high. You know, if their body is naturally kicking up that high, there's a reason behind it. It's not just because doing it just for the heck of it.
So how do you stop it?
I'm going to get to that. Good question. How do you stop it? Chiropractors allow healing at all cellular levels. Okay, that's just a bottom line, just a blanket statement. This procedure has the effect of not one but two blood pressure medications given in combination, and it seems to be adverse event free. We saw no side effects and no problems. That was George Bacris, MD of the University of Chicago Hypertension Center, as published in WebMD. He was talking about a chiropractic adjustment. An atlas adjustment. By adjusting the atlas, it has the effect of not one, but two blood pressure medications used at the same time. So what should every person with blood pressure be doing? Getting adjusted. Every single person that has blood pressure problems, they should be here getting adjusted. That's what should be happening, not getting on the drugs. Okay, the right way continued. NeuroCleanse restores many digestive and systemic processes by removing toxins from the cells. So, you know, you go the neurotoxic route and you start clearing out the toxins. What do toxins do? They cause inflammation. So as you get the toxins out of the system, now the inflammation begins to settle back down. But not only that, you also have the secondary part of it, that if you're decreasing toxicity in the body, you're also improving on the organs, the systems, and the processes that deal with inflammation by nature. So those systems and organs and processes can work more efficiently at further decreasing the inflammation. Do you follow? So I mean, it's a multi-targeted approach. Just by, you know, here's what you need to know: remove toxins, right? That's what you need to know as a patient. Remove toxins. Surge training reduces inflammation and burns up sugar. Every time that you exercise, you're burning sugar in your system and in your cells. So the more exercise you do, the more you're getting rid of the ages. It's just kind of ironic that they call it ages, doesn't it? So surge training really does that faster than any of the others because it causes massive burning of sugar. So if you don't know how to do the surge training, pick up the 5 Essentials DVD, and that shows you exactly how to do the surge training front to finish. Or come to a makeover, whenever the next makeover is. The healing diet eliminates all incoming sugar, period. Okay, so there's no better way to get it out of the system than to just eliminate all incoming sugar. That gives your body a chance to rid sugar congestion and heal the pancreas up. Okay, it gives your body a time to reestablish itself, and start dealing with what's in the cells before you just keep on pouring in new supplies of sugar that the body already can't handle.
What's the incoming sugar?
Say that again.
What are the incoming sugars? Like
Income.
sugar we eat?
Here's the healing diet. To answer that question, what are the incoming sugars? The answer is get rid of all sugar, okay, meaning like cakes, sweets, candies, cookies, all that kind of sodas, corn syrup, any of that kind of stuff. Anything ending in ose, right? High fructose or sucrose or maltose or, any of that stuff. You get rid of all that stuff, okay? Second thing, get rid of grains. Okay, because grains convert into sugar in the body. Okay?
Grains like?
No, grains. Grains like wheat and oats and barley and all that kind of stuff. Get rid of grains completely. Pasta, rice, all of that. Bread, okay? And then the next thing, yeah. The next thing, get rid of fruits, okay? Because fruits break down into sugar. Okay, so it breaks down into sugar. So all those three things break down into sugar. So what are you left with? You eat a real diet, which means protein and vegetables. Protein and vegetables. That's really what we should be eating anyways. So.
Well, what about potatoes? Potatoes is a starch.
Potatoes is a starch, which break down into.
Yes, but it's not
sugar.
It doesn't fit in any of those categories. It's a vegetable.
Yeah, but you can't eat. Well, that's also in the healing diet. The advanced details of it is don't eat any root vegetables because they're starchy. So the next thing is check your protein and increase your fats, good fats. We're not talking like, take out the jar of Crisco and start eating it by the spoonful. We're talking, good fats like coconut, real grass-fed butter, grass-fed meats. We cook with grass-fed meat. We eat grass-fed meat. And today, we had some meat with our lunch, and my wife was sitting there, and she goes over to the sink and she starts to pour the fat out of the pan. And I'm like, "What are you doing?" She's like, "Well, I'm pouring out some of the grease." I'm like, do you not know the healing diet? Do you not know how this stuff works? So we had a little educational lesson there in our kitchen. Just about you can eat the fats. The fat is not the cause of heart disease. It does not. Does it look like it makes you fat? Fat does not make you fat. I eat all kinds of fats, but they're good fats.
We eat all the fats with all this other stuff, what we eat, what I eat. And I really thought I was doing good. I was eating plenty of vegetables and plenty of fruit.
Mm-hmm.
And less,
and that stuff is good for you. The eating the vegetables and the fruits is good for you if you're not on the healing diet. But if you're trying to get your body into fat burning mode, you'll never do it by putting sugar into the body. That's the whole point of the healing diet, is you got to get rid of all incoming sugar, because then your brain looks at it and says, it's stuck in sugar burning mode. So as long as it's in sugar burning mode, is it ever going to attack the cellulite around the thighs? No. Yeah. So, it's not going to attack that because you keep on giving it sugar.
How long do you stay on that?
You stay on it as long as it takes.
But I mean,
it's just
if fruit and stuff is good for you, then when
yeah.
do you put it back in?
When you get back to homeostasis, which means ideal body weight. Once you go back to, how do you think they do this stuff on like The Biggest Loser and all that kind of stuff? They cut all the carbs out. They cut out all the sugars. That's how they do it on these shows. They're feeding them all. You watch the shows, they're eating all kinds of vegetables and stuff like that, and they're burning off tons and tons of energy. But the bottom line is, you've got this specifically is designed around getting you into fat burning mode. You'll never get into fat. Again, this goes down to the most efficient path. Okay? Fat is harder to convert into energy than sugar is. It takes more work. Okay, sugar is literally instant fuel. It's like rocket fuel compared to unleaded gasoline. Okay, so you've got to convert, if you're looking at which one to do, you go to the sugar first because it's fast. So, but if you get rid of that and your body can't do that, what's the first thing that happens? It starts freaking out and your brain starts sending you signals, eat sugar, eat sugar, eat sugar. What do we call those? Cravings. Okay, so once you stay away from those cravings for a while, though, you'll get over this hump where all of a sudden your brain figures out you're not getting any sugar, so it immediately has to do something else to react, so it starts looking for other sources, and what does it find? Cellulite. It finds fat. So it turns over and starts burning fat again. And then once you're in fat burning mode, you can restrict the sugar, as long as you need to get rid of whatever you need to, and then you can go back to homeostasis as long as you give yourself good fats. It's all about healing up the receptors of the hypothalamus and every other organ that has to deal with the whole process. But that's a whole nother workshop, it's just on the healing diet. Okay, so L-arginine, magnesium aspartate, and grapeseed extract increase production of nitric oxide, which allows for dilation and relaxation of the arteries. So this does not mean, and I'm going to put a disclaimer here, this does not mean eat what you want, keep taking your drugs, and go and get on L-arginine, magnesium aspartate, and grapeseed extract. It doesn't mean go down to the health food store and get on these things and everything's going to be okay. These things help, but it's just part of the process of getting everything working together, right? Okay, tannic acid from the banaba leaf mimics the action of insulin to shuttle glucose into muscle, which it can then be burned. Okay, the drug companies do definitely not want you to know about banaba leaf. So they're the tannic acid. They've got kind of under control. I think. I'm thinking either that or another product in the banaba leaf you can't buy in a concentrated form. The FDA has gotten rid of it in concentrated form, but you can still take the banaba leaf and get the same effect. It's kind of like you can't get Laetrile. You can't get Laetrile, but you can still buy apricot seed kernels. So you can still get it from the real source, which is how you want to do it anyways. So, the bottom line with all this stuff, it's just you can see the mass deception that's going on here. And so obviously, there's steps that everybody needs to take on their own part to make sure they're not a part of it. But are you really going to sit there and let your sister or your brother or even your neighbor continue to do this? Are you going to let them just sit there and continue to go down the same path without talking to them? I mean, how can we do that? It's literally... Again, it's the same thing every time, a moral and ethical obligation to talk to people, to tell them what's going on. I mean, you've got your whistleblowers, but, their whistle is only so loud. But imagine if everybody had a whistle and blew it at the same time. You could crumble walls. Okay, you could literally see walls crumble because of that. That's what it's going to take. So you've got to get out there and talk to people. So, we do have an open house this Friday that I want to make sure everybody knows about. But as far as tonight, does everybody know one person that's taking cholesterol or heart disease medication of some kind? One person. Raise your hand. Okay. So that one person, whoever it is, put their name down on a list that we call. April, grab the sheets on the way out. And put their name down on the list. We'll call them and invite them to the open house on Friday. Okay? And we can go through, the basic processes, the basic fundamentals and everything. If, we'll give them whatever resources they need in order to get the right...
I'm thinking about diabetes.
Okay, so that person needs to know it too. Okay? So diabetes, heart disease, it really doesn't matter. And if you know more than one person, put more than one person out. it's just, who doesn't deserve to know this? Does anybody not deserve to know this? I don't know, maybe an ex or something like that, but everybody else really deserves to know this stuff. So we can't just sit there and not say anything and just let them continue to die. Now, we also have a makeover dinner on the 23rd. If this is, if you know somebody, but you know that they're not willing to make the, a step, and they're not necessarily ready to, to come into the office right away and do something about it, that they need more information, that kind of thing. They need more knowledge. They need to read more books. That kind of stuff. Really, I'll tell you the truth with that situation. It's usually that's the excuse. If they really did want and need the more information, then they would have done it already, and they wouldn't be on your list in the first place. You know what I mean? So typically I find that's called an excuse. Okay. So, but just in case, those people, get them to the makeover dinner on the 23rd. We do have that coming up. And then the next actual makeover is March 14th. We're going to be going through all kinds of, all the healing diet stuff, all the surge training stuff, all the toxicity information, all the dietary rules, additional stuff about the nervous system and chiropractic. I mean, we go through all of that stuff together in one shot, 1 3.5 hour section. So everybody make sure that you're signed up for that.